Story time. What's the most gruesome injury I've seen as a trauma anesthesiologist? For those who don't know, I'm Dr. Hassan and I'm a trauma anesthesiologist. This patient that came in was a person versus car versus wall. This is a common way we describe patients when they come into the hospital. Person versus car, person versus mobile machine, person versus motorcycle, person versus gunshot. Actually, for gunshots, we say GSW. Anyways, when we first saw him, he came up from the ED straight to the operating rooms. He had a giant hole in his head where his skull had actually been crushed, and there were parts of the insides of his brains that were showing. There was a profuse amount of blood coming out of his head. He was technically alive because he had a blood pressure and a pulse, but his pupils were blown and his head was actually blown as well. He had a massive transfusion protocol initiated. He had blood, fluids, medicines to keep his blood and heart going. The surgery was to initially fix whatever the trauma was in the whole body, not the head, because the head wasn't life-threatening bleed. He technically survived the operating room and made it to the ICU. However, he passed away afterwards. The reason why this sticks in my head is because as anesthesiologist, we stay at the head of the bed, and the head of the bed here had a